Again, this week, coronavirus is the story of the week, and the public health sector is in overdrive to keep it from becoming the story of our lifetime. But in the next 60 seconds, more Americans will die of heart disease than from coronavirus. Why? And how can you avoid either? Let's ask Dr. Anuj Shah. His multiple board certifications include interventional cardiology. Doctor, welcome.
Thank you so much, Holland. Looking forward. How are you doing?
Good. Doc, a while back we interviewed a divorce lawyer of some notoriety whose book is titled, "If You're in My Office, It's Already Too Late." And when I hear you introduced as an interventional cardiologist, the little voice in my head says, how can I avoid needing an intervention? What are the most common reasons your patients end up your patients?
So interventional cardiologists is doctors who go and intervene, which means if you have a blockage in your heart arteries, we go and open it up. You're having a heart attack, we go and fix it. Same way, I also do peripheral vascular, which means if you have blockages in your leg arteries, we go and open that one up. So if you do want to avoid me, and if the commonest reason people see us is when they have blockages in their heart arteries, getting chest pain or heart attack. Same way when they have blockage in their leg arteries, getting leg pain, discomfort, or when they're actually having ulcers which don't heal and they need amputation.
So do exercise, quit smoking, et cetera, lose weight, all of that?
That's right. Do exercise, lose weight, quit smoking, make sure your blood pressure, cholesterol, diabetes is well in control, and if you have symptoms, seek attention. Peripheral arterial disease or leg blockage is a very, very serious problem. We always say legs are the window to the heart. Oftentimes, patients don't realize it, patients ignore it, doctors ignore it, don't ignore it. Having amputation is a pretty bad problem. People's lifestyle completely change, but not only that, people who have blockages in the leg arteries are the same folks who have risk of heart attack and risk of stroke. So seek attention, seek early treatment before it's too late.
Hey, settle a bet for me. In one ear, I'm hearing, avoid chocolate, it's sugar, it'll make you fat, you'll get diabetes. In the other ear, I've heard that chocolate is good, and lately somebody told me that cocoa can actually help my heart. Who's right?
Yeah, so most of the chocolates available in the current market, unfortunately, have very high concentration of poor fat metabolism and poor free fatty acid. Having said that, the really bitter or the dark chocolates, which has very high concentration of cocoa, is now lately we are finding that it actually helps with blockage formation, and especially when people have peripheral arterial disease, it improves their walking distance. So up to 3 to 4 drinks of really bitter, dark, hot chocolate can actually be helpful with a lot of cocoa in it.
Memo to the Easter Bunny. Now, about coronavirus, as I've read up on this, I spotted a bulletin from the American College of Cardiology, and my layman's reading surmises that patients with cardiovascular issues could be at increased risk of coronavirus. Have I got that right? And are these folks similarly at risk to flu?
Yes, absolutely. So to me, it's very surprising that nobody's talking about it. And we hear about coronavirus and unfortunate death and demise from it. But I haven't heard anybody talking about it enough that people who have cardiovascular disease are the people who are actually at very high risk of potentially dying from coronavirus. As a matter of fact, there are studies quoting that 40 to 50% of people who ended up dying from coronavirus had some kind of cardiovascular risk factors. They had low immunity because they had diabetes, hypertension, high cholesterol, and they had underlying cardiac disease. Not only that, up to 20%, 19 to 21%, if we quote the studies exactly, ended up dying from cardiovascular causes. So if you happen to have cardiovascular disease, you are more susceptible to potentially having larger impact of coronavirus.
Well, we talked about watching your weight, quit smoking, eat smart, get some exercise. What else will help boost immunity? Do vitamins help? And how important is a good night's sleep?
Yes, sleep is very underrated. Sleep, along with other things, as you mentioned, diet, exercise, quitting smoking, and also paying attention to sleep is very important. It's not just the amount of sleep that you have, it's not just the duration or the quantity of sleep, but it's also the quality of sleep, what kind of sleep we have. And now we have tons of biomarkers which can measure the quality of sleep, and we have seen better impact on improving immunity. Same way, practices like gratitude, meditation, those things have also led to increased immunity as well. So yeah, sleep is very important.
At 3 different CVS stores in 3 days, the person right in front of me in line was asking for surgical face masks, and the person behind the counter said, we're all out of stock. Should we be walking around wearing face masks, at least until this corona thing passes, or for the flu season? And what about hand sanitizer? There's been some controversy that we're tempting superbugs to jump the fence, and that simple, frequent hand washing should suffice. True or false?
Partially true. So I think the importance of hand sanitization and face masks cannot be more important than ever before right now with the coronavirus ongoing. First of all, I want to make sure that people understand that what you need is a proper mask, which is N90 mask, which can potentially protect from coronavirus, and most CVS stores don't even have that available. Having said that, this whole conversation goes back to the original conversation I had, which is about immunity and underlying cardiovascular disease and underlying risk factors. So if you are somebody at risk of developing, susceptible to catching infections, you got to make sure you are applying all the proper hygienic techniques, which is hand sanitization as well as using the proper masks.
Dr. Anuj Shah, thank you for your help with this important story. I appreciate your time.
Holland, thank you so much for having me.
And thank you for watching The Big